Let's get more on this now with Dr Margaret Harris. She is a spokesperson for the World Health Organization and joins us now from Geneva. Good to have you back with us, Doctor. As we heard from our correspondent on the ground in Gaza, the spread of infectious diseases is now becoming a real worry across the enclave. The World Health Organization has said as much as well. Just how bad is the situation now in terms of the spread of those diseases in the enclave?
It's very, very bad because people haven't got any means of avoiding the catching these illnesses. We've seen more than 100,000 cases of hepatitis. We're seeing cases of meningitis. We're seeing, as you mentioned, diarrhea, dysentery. And this is all on top of people starving, people struggling to get adequate food. So diarrhea for most of us is uncomfortable, but if you're starving, and especially if you're a starving child, that can be a death sentence. And even other things like nearly everyone has some kind of skin disease, either from mosquito bites, insect bites, or scabies or lice. And again, that means you can't sleep at night, you're itchy, you're miserable. So all these things are combining to threaten people's health, both physical but also mentally.
And your organisation has been sounding the alarm on this and other medical-related issues for many months now. Exactly what needs to be done at this point in order to stop the spread of these diseases that are claiming lives?
So, well, several things. First of all, people need to have access to healthcare, which they don't have. There are only 16 of 36 hospitals functioning in any shape or form, and most of those don't actually have adequate access, which means that the ambulances can't get there, the people can't get there because the roads aren't working. But they are also really, really undersupplied. So we do our very best to get supplies to all the hospitals, but much of the time we simply can't get in. We've got 30 trucks waiting on the other side of the border to go in. We did manage to get 11 trucks of supplies in last week. We try to bring fuel to help the hospitals to function. But all these things are tiny, tiny band-aids. What's only really going to work is a true ceasefire. And if they can't organise themselves to have a ceasefire, at least give us some days of tranquility so that we can get in there and provide the aid and provide the vaccination that's desperately needed.
Yes, and we know that the delivery of aid into the enclave has been haphazard at best. You say you've got dozens of trucks waiting to enter Gaza right now, but it seems to be very unpredictable in terms of how and when these trucks will be allowed to enter. Is there any movement or perhaps any diplomacy behind the scenes that's going on right now in order to facilitate the delivery of this much needed aid?
There are daily representations at all levels, because we're talking about people's lives. This is not some sort of just story. This every day, and many of the people we're talking about whose lives are being lost or being damaged irrevocably are children. So it's not something we can afford to just say, oh, well, isn't that tough? It's something we must do something about as quickly as possible. And every day we don't, things get worse and worse and worse.
Okay, Dr Margaret Harris, we will have to leave it there, but the very best of luck with the WHO's work, and thank you as always for joining us.
And thank you for having me.